For pelvic organ prolapse and urinary incontinence, there's a whole gamut of options, ranging from non-surgical conservative options to surgical options. In terms of surgery for pelvic organ prolapse, there are several approaches. One approach is a vaginal approach, where we do the whole surgery through the vagina. Another way to approach pelvic floor reconstruction or prolapse surgery is through the abdomen. When we're doing abdominal surgery, there are two main ways to do the surgery. We can do a really large incision, or we can do really tiny incisions. When we do the tiny incisions, those are called laparoscopic surgeries. Laparoscopic surgery has the benefit over the open surgeries in that there's less blood loss, less risk of a blood transfusion, less need for pain medicine after surgery, and overall a much quicker recovery. In terms of doing the laparoscopic reconstructive surgeries, I enjoy doing the surgery with a tool, the Da Vinci robot, as that is a nice tool to use in that it gives me a 3D magnified view, so I can see a lot better, and it has wristed instruments. That means that the instruments, the very ends of them, move around like a wrist that helps me get through tight spaces in the pelvic floor area. For the patient, we see a lot of great benefits for them with this technology because, like I said, they have decreased blood loss, they have decreased risk of blood transfusion, and a quicker recovery. In fact, almost all of my patients are back to work full-time at 1 or 3 weeks, depending on the extent of surgery that they had. For incontinence issues, we have a whole range of options to treat urinary incontinence and fecal incontinence. And we have to go through some testing sometimes once patients fail conservative measures to see what other minimally invasive options that would be good for them to treat their condition. Some options may include a bladder sling, a periurethral injection. InterStim is a sacroneuromodulator, which is just a fancy little device that overrides what you could think of as the broken sensor for the bladder. We have other minimally invasive options for overactive bladder as well, including Botox injections.